Hello everyone, I am Dr. Idrees Mubarak, Specialist Endocrinologist, Aster Hospital. As we all know that holy month of Ramadan is around the corner and we are all excited about it. However, the month of Ramadan presents some unique challenges to the patients of diabetes. Various surveys have found that at least 70% of patients with type 2 diabetes and 40% of patients of type 1 diabetes observe at least 15 days of fast during this month. Today we will be briefly discussing about the challenges that this month presents and some possible solutions to it. We know that people consume large meals in Ramadan, especially in iftar. Almost up to 1500 calories are consumed at once. Not only the quantity of meal, but also the quality of meals changes. People eat more sugary stuff, more desserts, more juices, more drinks. And all this leads to increase in the post-meal blood sugar level. There is a spike. Also, there is change in the sleep pattern, there is lack of exercise, and obviously during the non-eating interval, the patients are more predisposed to development of hypoglycemia, which is low sugar. All these changes, all these challenges, they predispose to the development of complications like, as I said, high blood sugar is called as hyperglycemia, low blood sugar is called as hypoglycemia. It can also cause dehydration, and in extreme cases, it may lead to thrombotic complications, which we commonly call as clotting. Now, there are some do's and don'ts which are to be followed in order to minimize the risk of these complications. Starting from suhoor. This meal is very important and should not be missed or not taken earlier than its usual time. A lot of people take early suhoor because they find it difficult to get up at that time, which increases the duration of the fast and predisposes to the development of hypoglycemia or dehydration. The type of food that we eat at suhoor is also very important. We should avoid sugary stuff. We should take more of fruits and vegetables. We can eat lean meat. We can proportionately take more fat and protein because it is more satiating. We should avoid soft drinks or caffeinated drinks like tea, coffee, because they can act as diuretics and increase the chance of dehydration later on in the day. Then during the day, especially afternoon onwards, we should check the blood sugar. And one should immediately terminate or end the fast if blood sugar levels fall below 70 mg per deciliter or they are more than 300 mg per deciliter. Or if the patient feels symptoms like shivering, sweating, palpitations, confusion, dizziness, etc. Coming to iftar, iftar should start with a large quantity of water and maybe up to 1 to 3 dates. Ideally, the evening meal or whole evening food should be divided into 3 parts. Almost around 25 to 30% one can take as iftar. 50% one can consume after Maghrib prayers, and then remaining 15 to 20% one should take after Isha prayers. If one says Tarawih prayers, then that will be considered as exercise as well. Also, you should consult your treating physician regarding the timing and dosage of medications, as there are some medications which have more tendency to cause a low sugar or dehydration, and their dosing and timing may have to change during Ramadan or may have to be preferably stopped during Ramadan. So, if you are planning to observe fast in the upcoming month, please don't hesitate to visit us and seek advice regarding the timing and the dosage of medications and other stuff. We for sure will treat you well.